Within an hour, I'm about to start the Spravato treatment. I've been in a real slump. I don't really know if this is going to work. I don't know what I'm going to do if it doesn't.
In 1970, the FDA approved racemic ketamine, commonly referred to as just ketamine, for use as an anesthetic. The dissociative effects of ketamine that made it a good anesthetic also made it a bit intriguing for recreational drug users in the 1980s. Special K, as it was referred to, was so popular in the 1980s that it was referenced in the fourth season of the hit show Stranger Things. However, recently, ketamine has started to get a new role in medicine, that of an antidepressant. Ketamine is what's known as an NMDA receptor antagonist, which means it blocks the activation of the NMDA receptor. Because of this, researchers started to look at ketamine as a potential treatment for depression. However, there were a few obstacles in the way of ketamine becoming a treatment for depression. Firstly, there are a lot of side effects, but with close monitoring and only using therapeutic doses, those should only last a few hours. Another obstacle in its way is it is a restricted substance due to its history as a recreational drug. That causes a bit of stigma, and it makes insurance companies a little wary of covering it off-label. But if enough evidence is gathered that supports its use as an antidepressant, the FDA could actually approve it for such use. However, that is where the third roadblock comes in: money. Newsflash: despite what many conspiracy theorists might say, it is actually pretty hard to get a drug approved by the FDA. For a good reason. It takes a lot of evidence supporting both the safety and the efficacy of the drug before the FDA is willing to approve it, particularly for restricted substances. Most of the time, these studies are paid for by pharmaceutical companies trying to bring a drug to market. All of that money spent on research is actually an investment, allowing them to be the exclusive seller for that drug for the 20 years while they have the patent. When a business sells a good that is less substitutable, they do have significant pricing power, which makes it easier to have a good return on investment for all that money spent on research. Because it is so old, ketamine's patent expired decades ago, so why would a for-profit corporation spend millions of dollars just so every other generic drug manufacturer can just leech off all of their work? Well, remember when I referred to ketamine as racemic ketamine? I wasn't just saying it to sound smart. The first word of its name, racemic, is actually pretty relevant here. It means that ketamine isn't actually a pure uniform chemical, it's actually a 50-50 mixture of two other chemicals called enantiomers. These enantiomers are essentially molecules that are mirror images of each other, one by the name of R-ketamine and the other by the name of S-ketamine. If a pharmaceutical company, let's say, were to isolate one of those two enantiomers and turn that new isolated chemical into a drug, that drug could actually be patented. And that is exactly what the company Janssen did about a decade ago. They created an S-ketamine nasal spray that was approved by the FDA in 2019 for treatment-resistant depression patients when using another typical antidepressant in tandem. In 2020, it was also approved for patients with acute suicidality. And earlier this year, it was approved as a standalone treatment for treatment-resistant depression. The drug, branded as Spravato, is to date the only version of ketamine that is actually FDA approved for the treatment of depression. But we still could see more in the future, for example, an R-ketamine nasal spray. Just to note, S-ketamine was chosen particularly because it more effectively antagonizes the NMDA receptor. At the time, ketamine's effect on the NMDA receptor was believed to be the main mechanism that gives it its antidepressant effects. So if S-ketamine was more effective at that role, then we should hopefully be able to get the same efficacy for the treatment with a lower dose and also hopefully lower side effects. However, we undergo certain medical treatments in order to get a certain medical outcome, not just to better target a certain receptor. There are other neural mechanisms involved in ketamine's antidepressant effects, so a future R-ketamine drug could be more effective. We just don't have the research saying either way. Though for now, of course, Spravato is all we have, and it's actually the drug that I have taken. Honestly, it just astounds me how much my mental health has improved since starting Spravato treatments. My depression didn't just magically go away, and the treatment path I've been on has been rather rocky, but I just can't easily put into words just how life-changing it has been. The good news is I might not have to.
Within an hour, I'm about to start the Spravato treatment. It took so long to finally figure this out. It's sort of surreal that it's actually starting, and I'm unsure whether it's actually going to have an effect. I wanted to try to record this so I could see the change in how I feel and how I processed life before and after, and I guess during. I guess it was kind of hard because I haven't really had the motivation to try beforehand. I was thinking about doing this for a little while, but I just haven't really had the motivation to do it. So it's sort of a last minute thing, and I don't really know what I'm going to say. In many ways, because so many things haven't worked, I don't really know if this is going to work, but I'm hopeful to some extent. I don't know what I'm going to do if it doesn't. I've been in a real slump for a few months now. I haven't had a haircut, I haven't shaved. It's been rather bad. Sometimes part of me wonders whether I really want to get better. People tell me I do want to get better, and I'm just not. I really don't know. And I question myself all the time whether I want to get better, whether I'm truly depressed. And because I have moments where I sort of feel fine, but those are fleeting. And during those moments, I just question myself and wonder, like, oh, is the reason why I haven't gotten anything done or I haven't cut my hair, I haven't shaved is because I want to have an excuse for not getting anything done. I want excuses for not pursuing anything in my life. It really like screws with my head, and I'm hoping that this can help me change my perspective. At least that's what I've read about what it can do, what Spravato can do. So I'm really hopeful that that in particular can help me. It's been a few months since I've actually done much that is productive, whether that be cooking, anything significant, shaving, or getting my hair cut. I do realize that it is something I need to change. But then I question myself, like, why haven't you done it? Like, you know it's an issue. Why haven't you done it? I really don't know what I'm doing here. And I don't know what I'm supposed to say. So, all right, I'm just going to end this.
Honestly, I get a little emotional every time I rewatch that. Just how far I've come since then is astounding. I back then I was just, I guess, a failed gifted kid, and I in the past I was able to get into one of the best colleges in the world, but then my freshman spring things just went really downhill, and I ended up in the mental hospital before the semester ended. Now at 23, I still have only completed that single semester of college, despite trying to go back to college again when I was 20. But that still didn't go well, and then that things got worse and brought me to where the video you saw was. And during that recording, I was at rock bottom, and receiving the ketamine therapy over the next few weeks was absolutely life changing. Again, please just don't get me wrong. My depression didn't just magically go away. In fact, I continue to have some periods that are really rough. But every time I look back at that recording and the subsequent recordings I will soon show you, I get a little hope. They show me that things can get better because they have gotten better. I have gotten better. If your doctor has suggested ketamine therapy and you're still on the fence, please let me show you just how much I've gotten better. Please let me show you how that rocky road is still so worth taking.
This is a few hours after the end of the Spravato treatment. I think a bit better, but I'm really unsure whether it's just a moment where I'm not that depressed versus like me just actually feeling better. I wonder if it's a moment where I just am a bit better or I just don't feel as bad because I'm not say, thinking about bad stuff or I'm not really questioning things at the moment or I wonder if I'm really unsure if it's me feeling like n- the fact that I'm not feeling terrible about myself right now is because of the medication or just random chance. I definitely don't feel terrible. I guess we'll see how it affects like my daily activities, whether I start to get more things done. I'm also not really the best at gauging my mood. Yeah, I'm not really the best at like understanding like what emotions I'm feeling, which I don't think is that uncommon given that in depression like screeners they ask about like what activities you're doing and seeing what you're feeling is affecting your daily life. So I guess I'll have to see how with continued treatment, my activities are affected by doing this bravado. When I was actually there, it wasn't like too scary or too difficult. I just got there, did the self sniffing, administering of the medication, and then they just had to take my blood pressure a few times just to make sure it was safe. And then I think the doctor came in, and 30 minutes after I started, yeah, she asked how I was doing, and I said, I truly feel like I know what dissociating means now. I'm not 100% sure that I even spoke to her just because it was at the peak of the medication. It is a fragment of my memory that's there. Any other sort of conversation that is that brief and is that significant during a time that's like pretty uneventful would be, I guess, pretty memorable to me. But I guess because of the medication, I don't know that it happened with 100% certainty. It's probably like 60 to 70% sure that it happened. And the only reason it's that high is because I know I was told beforehand is that the doctor would come talk to me. So, and that's the only thing in my memory that sort of relates to a doctor coming. So I'm assuming that that was like what happened. I wouldn't really call the experience like fun or enjoyable, but it also wasn't like terrible or scary. It more of just was what it was. It was weird, but it wasn't like incredibly scary or off putting. It's probably not something you want to be constantly in, but as something you have to do every once in a while in order to maintain your mental health. I definitely wouldn't find it burdensome to do so with a somewhat regular basis just to keep everything up. I sort of felt heavy but light at the same time, to where all of my limbs were like felt super light, like they weren't there, but I also felt heavy in the sense that I wasn't moving. Sort of weird in that sense. When looking up videos on how it sort of felt like when deciding whether I wanted to do it, I often got the idea that it would change the way I view the world and it would allow me to view my life in different ways. And I don't really know if that's happened yet, at least. I didn't really do much thinking on there. Like maybe it was because I was listening to some music, but I did specifically choose studying music just so I wasn't being influenced by the words or whatever I was hearing in whatever normal music I listened to. But I definitely didn't just question my life and how I feel and allow that to look at me, look at problems in a different way and get answers. But this was also my first, my first visit.
Because of ketamine's history as a recreational drug, it might seem scary to some. Personally, I didn't tell my dad what my new depression treatment was until a few months in, where he could actually see the progress himself, because I was so afraid he would judge me or get mad at me because I was using drugs. As my past self told you, the actual reality is far from scary. Yes, it was, pretty weird at first, but I got used to it after a few treatments. Sometimes though, I still dissociate pretty hard. My best suggestion would be to just keep your eyes closed, listen to some music, and just relax. It goes from a really weird and mildly uncomfortable situation to one that is just a super pleasant time of rest.
Earlier today, I had my second Spravato dose. Today, I didn't have a trip or anything. I just sort of felt sleepy and maybe a bit weird at the start. Afterwards, I'd say I wasn't happy, but I definitely wasn't sad or super depressed. And I feel like it was only noticeable just because of how low my mood was prior to starting. Prior to the appointment, I was just in a very dreary mood. And after, I guess it was a bit neutral. I sort of feel a sense of peace. I don't know how long this will last, and it might be because I'm running out of things in my YouTube recommended that are novel, but it also could be that it is working and I have been given a crossroads. I have been given the ability to try and start to do something else a bit more productive. And I guess we will see where that leads, whether it is permanent or whether it's just this moment. And or if it is right this moment and I waste it, then I'm probably going to be pretty upset at myself. But I guess it's a big jump from just not doing much to just trying to do everything right now, just because I do sort of feel something, just because I feel that I could do something right now. I guess we'll see how permanent this feeling is.
It's amazing just how in a few days you could see so much progress after months of just going downhill. I mean, I actually felt hopeful. But again, there were many ups and many downs, as as you will soon see.
It's been a little bit since I did this. I was planning on doing this a bit earlier, but depression sort of did what it does. After the my second dose, I was feeling pretty good, and then like the day after, I was able to shave, which was the first time I did that in 5 months. I was pretty hopeful. However, like the next week wasn't the best for me. After like some binge eating and then just lying in bed a lot, and it wasn't a good week. And I just didn't do any like of these updates. I it got to the point to where I didn't feel hope anymore, and all I could do was just wait, just lay in my bed and wait for my next treatment, and hoping. Well, I guess I did have some sort of hope, but given that the last two I got worse, even though the dose increased, the hope was a little fleeting. But luckily, I did my 2 doses for this week. I'm feeling a bit better after the first one. I was better, but still not up. And then I had the second dose of this week, so the end of my third week, and I feel much better. I guess I need to get some sleep and see how that goes. I'm gonna try to shave again, and then even though I've sort of been procrastinating on that all night, but I'm gonna shave again and then go to bed so I can get some sleep before my dentist appointment tomorrow. While I'm out, I'm gonna try to actually get my hair cut, and that's gonna be the first time in like 6 months, I think. I definitely need it. It's getting pretty long. Hoping things continue like they are now, and they weren't like they were last week. But I don't know anymore. I guess we'll see how things go. So, as you might be able to notice, I did get my hair cut, and the dentist went well. I was able to actually go and do that, which is great. Overall, like the week has been very good. I just have one more treatment left tomorrow before I go to once a week, and hopefully, I guess it'll continue to go how it is now when I go down to once a week. But I guess we'll see. Also, in between my last treatment and this, I actually read a book for the first time in quite a while. It's got to be at least since the summer. That really means a lot to me because it's something I enjoy doing, but I guess it's harder to start. It's much easier to just pull out YouTube and watch something there. There's like nothing wrong with watching something on YouTube, but like being able to go through a book or go through like a research paper really helps get, I guess, deeper information, which is useful. So you're not just on all service levels stuff, but it just takes a little bit more, I guess, action potential to use, I guess, scientific phrasing or I guess chemistry phrasing. But that was really, really nice. Like just having a little bit more motivation. I've done some laundry, but I've not done as much like cleaning up and like housework that I was hoping I'd get done. But I guess there's still the ADHD to worry about. It's not just depression. Like now that I know that I have, I guess, a bit more motivation, what sort of routines can I develop? Because I know I'm still going to have issues getting things done and like getting distracted. I do find it interesting that like I still don't get everything done that I might want to. I gain the motivation to get out of my bed and get stuck in a video game or or something that might take a bit of effort to start. That's still like not what I consider like productive or whatever, which I know is not the best way to view things, but like things I know I need to get done and I know I need to start being able to do them that I haven't really been able to do. Which, it's good that I'm at least like getting out of bed and doing a bit more. I know this Spravato is not like a miracle drug where I take it and then finally I'm able to do all of the work I could ever want to do. I guess we'll see how things go.
I just want to briefly interject here and say that just because this was the treatment that worked for me doesn't mean it's the right one for you. Please talk to your doctor, not the doctor at the ketamine clinic, your doctor, your psychiatrist, your primary care physician, your doctor. There are a lot of downsides to ketamine therapy. I have to be there for a full 2 hours on a business day. I can't even drive myself there. I'm not legally allowed to drive the rest of the day because of the sedating effects. I need a family member to drop me off and pick me up during normal business hours. And even once I get home, the rest of the day I may not be able to do what I normally would do because I might be a bit more tired than usual. It's so much easier just to take a pill every day. But if those aren't working for you, I can say that the downsides of ketamine therapy just seem so minuscule. Again, please talk to your doctor.
It's been a little while since I've done an update or done another recording. There was some ups and downs, and the downs were just pretty bad. And for most of the time, I was just having a hard time, and a lot of the progress I made had gone, and then I was upset with at that. But I guess start from the beginning. I had my first week of a single dose of the Spravato, which went fine. And then I did a lot that week. I was able to clean up a bit more and do some laundry, like a decent amount of work, a lot of the work that I was trying to do that I was upset that I didn't get done before or when I was talking in my last update. And then I was able to do one big thing, which was make it to the gym, which I haven't done since last June. So it's almost been a year. It's been about 10 months. That was very meaningful to me, but I didn't really last because I guess the shipment of my Spravato didn't make it to my appointment date on time, so that had to get delayed, which I did okay with. But then it didn't get there again, so I had to miss another appointment, and then instead of getting another week, and I had to wait another week and a half. So 2 times in a row of waiting a week and a half in between doses when I'm supposed to be getting once a week, and this was when I was just trying once a week to see if anything's got worse. And I didn't do very well with that. I was generally okay around the times of the treatments, but other than that, yeah, I was not doing well. Which when you're in bed a lot and you don't have a lot of motivation, you're not going to make a lot of recordings to update. So that's why it's been a month since my last recording. Well, luckily, I actually got my medication on time last week and then again this week, and then they're shipping it early. So I should be able to get it on time from now on so I don't have to miss time, which is crazy that happened. But I'm definitely feeling a bit better, although my sleep is not messed up. And then I'm upset that I lost a lot of the progress that I was making. The once a week seems to be fine if the past week has been any indicator, but I guess we'll see. And I hope things continue the way they have been in the past week and not be how they were the few weeks prior. It's been a few months since the last time I made a recording. Things were going so well that we were planning on switching to every other week for the Spravato doses. That didn't go too well. I was okay for the first like 6 days, and then the day before I'd get my dose, if I was still doing once a week, I just had a really bad day, and there wasn't really the Spravato dose to sort of reset me, and I just spiraled down, and it wasn't it wasn't too pretty. I was able to make it to work the first few days or first few shifts I had that week. However, like the last shift of the week, I I made it there, but I left like 3 hours early because I just couldn't do it. I was just too sad for the days I did make it. I I may have been on the verge of tears for a bit after this Spravato dose earlier this week. I'm feeling much better. However, I don't think I'm at the place where I was prior to trying to skip that week. My current goal is to have a dose next week and then try to skip another dose. And hopefully it was just bad luck or I just had a bad day. However, I am definitely am worried that I might not be able to go down to every other week anytime soon, and that has me worried on the financial side because once the financial aid is up and I have to start paying for it, it's not something I can afford to do every week. I'd hate to be in the spot where I'm paying for a mortgage worth of ketamine treatments just to be happy and just so I can actually like work and be productive. And what's sad is that like generic ketamine, if I didn't have to pay for the people like being there, making sure I'm safe, which is important, but if I didn't have to pay for that and I just had to pay for the medication, I think it'd just be like $5 or $10 a dose. So it's really upsetting that getting the FDA approved version that's approved for depression is so expensive. I guess I'm gonna see how things go and try to figure it out.
Probably about time I address the elephant in the room. Cost. For me, there were two components of the cost. Obviously, the medication itself, but also the 2 hour clinic visit where they watch you after you take it. If your insurance actually covers Spravato, they have a program where your copay should only be $10 per session. Depending on your insurance plan and where you live, the cost of the clinic visit could be upwards of a couple $100s. My insurance did not cover Spravato. but at least it covered the clinic visit. Spoiler warning, with a retail price of over $1,000 a week, I would not be able to afford receiving treatment without insurance. But as you now know, I did end up receiving treatment, so how was I able to afford it? Depending on your household's income, you may qualify for the manufacturer's financial aid program where they provide the medication for free. Thankfully, I qualified, so I was able to start treatment. It may have changed from when I received it, but it only covered a year or a certain dollar amount of medication. I'm pretty sure I went over the dollar limit of the medication, and then they just let me stay on until the end of the calendar year, which wasn't a full year. So I have no idea what the actual details are. Because there was a limit to the financial aid, I felt a little pressure to try to decrease the frequency of my treatments as fast as possible. I needed to have a cost that was manageable once the financial aid ran out. However, a year later, I have completely failed at that goal. During every week I didn't get a treatment, my mental health suffered greatly. Luckily, I was able to start receiving Medicaid at the start of the year, and they actually cover Spravato, so now I don't have all that pressure to decrease my frequency as fast as possible. I can just focus on getting better, gaining momentum, and hopefully in the future I will be able to go down, but it's not a constant threat that I need to do it right now.
Well, it's been a while since my previous recording, but I thought I should make another one because looking back at my previous recordings have been actually pretty helpful when it comes to seeing how far I have come, and I definitely have improved quite a lot actually since my previous recording. Although there were definitely quite a few hiccups, my goal of trying to get down to once every other week hasn't come to fruition yet, and purposeful time I skipped a week didn't really work out well, and there was also a few times where the provider made a mistake in writing the prescription or billing that I ended up having to wait like an extra few days or a week to actually get my dose, and those all happened like in September. My September really was not good, and I didn't work too much late September and October. I did get a bit better in October, going back to every week, but it still took me some time. And then November is really where I made a lot of progress, but then definitely some downs as well. The beginning of November, I started going to the gym a bit more regularly. Towards the mid to late November, my sister's former service dog, they realized she had cancer, and a lot of my efforts went away from like going to the gym and eating a bit healthier, and went towards trying to help her out. And like, if I'm not working or if I'm not doing much, going over to her house so I can make sure the the sick dog has company while my sister's at work, and that definitely put a hamper on my progress on making sure I was getting back to the gym. But it's something I would do again in a heartbeat, and I don't see it as a failure that my gym progress stagnated a bit. It's still something I'm trying to get back into. My binge eating, especially over the past month or so, has definitely gotten quite a bit better. When it was really bad, I used to binge eat once or twice a week, but recently it's been every like 2.5 weeks or so, which has been very, very helpful when it comes to everything. My mood, my weight is actually starting to go down for once, which is a really weird change, but a definitely healthy one. I still have them, and when they do happen, it is still very distressing towards me, but I am happy of the progress I have been making. I only worked 2 days since Thanksgiving, and that's kind of upsetting to me because my mood has been actually very, very good over the past like month and a half or so. My productivity has not gone up as much as my mood has. I've only worked the 2 days, and then since the issues we were having in November, I've still had some struggles getting back to the gym and eating a bit better.
Unfortunately, the transition to Medicaid after that clip did not go smoothly. The clinic I go to, I guess, was used to me receiving financial aid, so they didn't try to get Spravato pre approved by Medicaid. So I didn't receive it, and then it took a week for them to actually approve it. So, it did not go well. But once I was actually able to receive my treatments, I was able to bounce back a little. It's kind of amazing when you're actually able to receive the medical treatments that you get every week. You feel much better. Another thing that helped me bounce back in February was a new antidepressant I started. It's called Auvelity. It is a relatively new combination drug that contains a NMDA receptor antagonist. My psychiatrist's rationale was that because ketamine seems to work for me, a antidepressant that was designed to help with the depression by antagonizing the NMDA receptor, like ketamine, could also hopefully work for me. It doesn't help me as much as ketamine, even at the maximum dose, but it does actually help me. So much so that I think I may actually be able to decrease my frequency of ketamine therapy to every other week. You may have noticed that throughout this video, I have really emphasized that my depression isn't magically gone. I still am pretty depressed. I've wanted to create this video for a little while now because a video like this would have helped me be more confident in actually going down this path, but also be much more prepared for doing so. I wanted to wait until I was in remission, I guess, because I wanted to have a more satisfying or fulfilling conclusion to my experience through all of this. However, that just isn't how things have played out. In fact, the ending you are seeing or listening to now is a completely different one compared to when I first started even recording this video. I do really hope that this video can help people who are questioning their treatment path. But that doesn't mean that I have to be completely cured of my depression in order to do that. I may end up dealing with depression like this for the rest of my life, so I can't just wait until my depression is over before I actually do this. If I want this video to be able to help people, I need to make sure it's actually out there for people to see and not just waiting to be done while I wait for my depression to be finally cured. Despite my mental health not being the best, or the audio or the color grading on this video being pretty imperfect, I think it still can be valuable to a lot of people. If it didn't, I guess thank you for listening to me for this long.